Hi everyone, welcome to ManpreetRN Talks, your one-stop destination for NCLEX success and nursing exam preparation. So here we break down complex nursing concepts, NCLEX style questions, drug reviews, and exam strategy into simple and easy way to understand the lessons and crack the NCLEX exam. So whether you are preparing for NCLEX RN, OSCE, or any other nursing school exam, so this channel will help you to study smarter, not harder. So let's start the topic. So without wasting time, please don't forget to hit subscribe and tap the bell icon so that you can get the video in time. So let's start the topic. So today's topic is NCLEX question solving strategies. This was step-by-step method that will help you to choose the right answer every time. So we will cover elimination techniques, ABC, Maslow, and test taking strategy that can boost your score. So let's get started. So grab your notebook and write down these game-changing NCLEX strategies. First, read the question carefully. So always look for keywords such as priority, initial, best, first, most concerning. So these words are very important. They will change the whole question meaning. So, and also identify if it's asking about for assessment, intervention, teaching, or evaluations. And next, rephrase in your own words. So just simplify this time. So for example, which question should the nurse take first when a client on digoxin report nausea? So is the question asking for digoxin toxicity? So recognition and proactive action is most important here. Third, eliminate wrong answers. So in the questions, always eliminate four options are there, and otherwise in the SATA question there are multiple options. So always eliminate the wrong options, such which options are not related to the question. So just cut it out. So use process of elimination. So this will help you to do all the answer in very quick minute. So use process of elimination in physiological impossible options and option that they are unrelated to the disease or medications. Duplicate or opposite answers. Often they are distractors. So eliminate that all the answers. Next one is apply Maslow hierarchy rules and ABCs. So in the ABC, airway comes first, then breathing, circulation, then safety and pain. So for example, if a patient is having pain plus anxiety, so treat oxygen or circulation first, not reassurance the patients. Next, look for priority words that are very important. For example, first, best, immediate priority that require critical thinking. So, most important teaching, safety related, not comfort. Next is consider assessment versus intervention. So, in this, it is very important to so write down if the patient is unstable, then first assess the patient before implement. If the patient is stable, then prioritize intervention and teaching first. So golden rule is here, assess before you implement. So unless you need to act to save his life immediately, so at that time always the patient is unstable, then assess first before acting. If patient is stable, then prioritize the things according to intervention and teaching. Next is think safety plus risk reduction. So, which option prevent complication or harm? So, always choose the answer. So, always save the client first. For example, for diuretics, checking potassium level is safer than just giving the drugs. So, think safety always 100% in the questions. Question next is use nursing process. So nursing process is the step they are assessment, diagnosis, planning, implementation, and evaluation. So NCLEX loves to test if you jump too quickly on the intervention. So unless there is an emergency, so assessment comes before implementation. Next, watch out for always, never, obviously these words. So NCLEX rarely use these words. So if the answer says always restrict fruits or never use oxygen, usually they are incorrect. So always watch for these words in the options. Next is trust general knowledge if drug and disease is unfamiliar to this. For example, unknown med or think beta blocker that slow the heart rate, lower BP. So safety concerns like bradycardia, hypotension. So these all are the NCLEX strategy. So next we will apply this strategy in a question so that you can grab it in your mind, so you can use in the when you are giving NCLEX exam or doing practice questions. So always apply this strategy. So let's start the questions. Question number one: a client taking furosemide reports muscle cramps. Which is the nurse priority action? So first, encourage ambulation. B, give an extra dose. C, check potassium level. D, restrict fluids. So, strategy here. So, just watch the word, priority word. Like keyword here is priority action. So, question are furosemide. So, furosemide, what is this? This is loop diuretics. So loop diuretics lose everything fast. So, there is risk for hypokalemia. So in this, we just eliminate the option that are not related to the questions, like encourage ambulation, that is not related to, so just cut it out. Give an extra dose, just cut it out. And de-restrict fluid, that is also not worsen the problem. So priority action is here, check the potassium level. So correct answer is potassium C. Next question. A client is found with shortness of breath, anxiety, and chest pain. So, what's priority action is here? A. Give morphine. B. Start oxygen. C. Reassures the client. D. Call the family. So, here we will use this strategy ABC. Always apply AB breathing circulation strategy here. So in this question, so we will use eliminate strategy for we will cut out the reassurance the client, just cut it out, call the family, just cut it out because that are not the priority action. Priority action is just patient is having shortness of breath. So we will apply either we give morphine to patient or start oxygen. So in the ABC, just we give airway, any oxygen to a patient. So correct answer is B. Pain and anxiety comes later. Next question, which need is the nurse priority? So a client hungry after surgery. B, client anxious about diagnosis. C, client with O2 saturation 85%. D, client asking about discharge teaching. So which need is nurse priority? So here we use Maslow hierarchy because in this physiological needs come first. So physiology needs include oxygen. So here oxygen comes before food and anxiety or teaching. So correct answer is C. Client with also oxygen saturation 85%. So we will that is the must priority for the nurse. Next, patient on digoxin reports nausea. What should the nurse do first? So here comes first. So just put underline the word. A, check digoxin level. B, hold the drug and call provider. C, give antiemetic. D, encourage fluid. So question is about digoxin. So C and D, just cut it out. That is not related to the answer. So in this, we when the nurse, what should the nurse do first? So in the assessment comes first before intervention. So we will check if the patient report nausea, maybe patient is having digoxin toxicity. So how we will assess. So just to check digoxin level first. After that, we will hold the drug and call provider. So correct answer is first is check digoxin level. So next question, which statement shows correct teaching for a warfarin patient? A, I will never eat green leafy vegetables. B, I will keep my vitamin K intake consistent. C, I can stop the drug if I feel fine. D, I will double my dose if I miss one. So here we will use avoid absolutes like always, never, these words. So in the option A, I will never eat green leafy vegetables. So this answer is usually wrong. So this is cut out. Next is I can stop the drug if I feel fine. So never stop the drug without without HCP order. So C is obviously cut it out. D, I will double my dose. So you should not double the dose. So C is D is also out. So one option is left. So I will keep my vitamin K intake consistent. So that correct answer is this. So warfarin patients don't avoid green, but keep intake consistent to prevent INR swings. A confused elderly patient keeps trying to get out of bed. What should the nurse do first? A. Apply restraints. B. Ask family to sit with the patient. C. Move the patient close to the nurse's station. D. Give sleeping pills. So, correct answer is C. Move the patient close to the nurse station because it maintains safety without medication or restraints. So, when the answer looks similar, choose the one that protect the patient safety. So, in this option, so apply restraints. So that is not done. So we cannot apply restraint in a patient. So just it is cut out. Ask the family to sit with the patient. That is not relevant. So D, give sleeping pills. That is not done. So A and D is cut out. So left out options are B and C. So in that, just which option are very similar to protect the patient safety. So safety comes first. So move the patient close to the nursing station is the correct answer. So that's all about this NCLEX question solving strategy. So always remember use ABC, Maslow, elimination assessment before intervention, avoid absolutes, and always choose safety. So practice this strategy daily and you will feel more confident in your NCLEX exam. So if you found this video helpful, don't forget to like, subscribe, and share with your nursing friends and comment below which strategy helped you the most. Thank you.